Imagine you're enjoying a game of soccer with friends when suddenly a collision occurs and someone sustains a head injury. In that split second, how do you react? Or imagine your elderly loved one slips and falls in the bathroom, hitting her head on the counter. As you rush to her side, you're faced with the daunting task of figuring out how do you approach their care, knowing the unique challenges and considerations that come with age. How do you decide if this person needs to go to the emergency department? You'll see here a quick reference guide of reasons to go to the emergency department. Together, we'll delve into one of the most common yet misunderstood topics when we talk about head trauma. I saw a large gap in what the public knows and expects when it comes to head injuries, and as members of our community, this is an opportunity to obtain a deeper understanding of this common injury. This is why I created Head Trauma, Understanding Assessment and Management for you. My goal is to empower you with the essential knowledge to identify and respond to the risks and signs of head injuries. No topic has garnered as much attention in the last 20 years as concussion. So we'll do a deep dive into this popular topic, separating myth from fact and understanding the intricacies of head trauma. As both a sports medicine and emergency medicine doctor for almost 20 years, I've encountered head injuries resulting from sports, from trauma, and from everyday life, making this topic particularly close to my heart. And during my career, I've dedicated my efforts to safeguarding the health and well-being of athletes, and I've had the privilege of contributing to influential national committees, shaping policies aimed at ensuring athlete safety. My hands-on experience on the sideline spans all levels and ages, from high school to professional and extreme athletes. And I've spent my career developing innovative strategies to mitigate life-threatening injuries like head injuries in athletes. And as my career has progressed, I'm working now to bring these innovations to a very different population, the older adults who present to the emergency department. By understanding how to provide support and care in these situations, we can make a meaningful difference in someone's recovery. When we consider the anatomy of the brain and the surrounding structures, an analogy would be to think of it like a coconut. So we have that hard outer shell of the coconut, and that represents your skull, which protects the delicate inside, the delicate meaty part, which is your brain. The brain is like the meat of the coconut, and it's crucial for all of your thoughts and your feelings and your movements. And this is all surrounded, the brain is surrounded by some fluid called the cerebrospinal fluid, which acts like the coconut water. It provides cushion and it provides support. And so this is the basic structure of the brain. We'll get into more detail, but this is the basic structure of the brain. So let's think of the brain in different parts so we can understand the different functions of it. The main part of the brain is called the cerebrum. It's the largest part. It's responsible for higher level thinking, such as problem solving and decision making, and it controls all of our voluntary movement. This is the command center of the brain, where all important thinking happens. In the back of the brain, we have what's called the cerebellum, and this is in charge of coordination, balance, and fine motor skills. It is like the conductor of an orchestra, and it makes sure that all movements in the body are smooth and harmonious. Next, we can talk about the brain stem, and this is what connects the brain to the spinal cord. But it also has some essential functions, the things we don't think about, like breathing and your heart rate and swallowing. So this is like the engine of a car. It keeps everything running smoothly and automatically, and we don't have to think about it. Next, we can think about the thalamus. This is a relay station in the brain, and all sensory information like sight and smell and sound and taste come through it, and then it's sent to appropriate areas of the brain for processing. I think we can liken this to, for example, a receptionist at a busy office, and it just directs all the incoming messages to the right departments. And then finally, let's think about the hypothalamus, and this regulates body functions. So, for example, temperature and hunger and thirst and sleep. So this is the thermostat and the timekeeper and the alarm system of our body. And it just makes sure that everything stays balanced. So each part of the brain plays a vital role in keeping us alive, functioning, and helps us to experience the world around us. But it does so in a very strategic way. Next, we can think about the blood supply to the brain. So this is what's bringing oxygen to the brain so it can do all of the things it needs to do. So this is really best thought of as a complex network of roads that deliver this oxygen-rich blood to the different parts of the city of the brain. So there are four main vessels that bring oxygenated blood up to the brain. We have the carotid arteries in the front, one on each side, so there's two of them, and the vertebral arteries in the back, one on each side, so there's two of those. The vertebral arteries travel through the bones in the neck, so they're very well protected. The carotid arteries are a little bit more exposed. Once the arteries get to the brain, inside the brain, there's a roundabout called the circle of Willis. And this is where all the blood is basically shared. But that way, if one of the four vessels is blocked or damaged, the rest of the brain can still get all the blood because it's all going through the circle of Willis. Once you get to the circle of Willis, where our roundabout, there's cerebral arteries that take the blood and send it to all different parts of the brain so that every part of it gets this oxygen-rich blood. And then surrounding the brain, and even within the brain, there's a very complex network of veins. And this becomes important when we start talking about injuries. There's a complex network of veins that helps drain the blood because you want to keep the brain, which is in this very finite, hard space that is not forgiving. You want to keep the pressure in this finite space created by your skull. You want to keep the pressure in there very regulated. So the veins help drain the blood that's coming in, the oxygen poor blood. And so overall, we have this complicated network of blood vessels that ensures that each part of the brain is getting its constant supply of oxygen and nutrients so it can function properly. So the brain is actually very vulnerable. Despite the fact that it lives in this very hard skull, it's a very delicate, intricate machine. So think of this like a computer. So even though a computer has a hard case, you can drop it, you can shake it, you can do things to damage the intricate wiring inside. And that's the same with the brain. If it's dropped or shaken, the brain is also vulnerable to this sort of trauma. When there's this sort of trauma, the brain, which sits right up against the skull in most people, the brain will hit the inside of the skull, and that can cause damage. And you can shake the brain, and think of that shaking a glass or a cup of gelatin, and that will also cause damage to the brain. There's two groups of people who are really vulnerable to head injury, and I just want to focus a little bit on them. The first is children. Children have, compared to adults, much larger heads. So because of that, the likelihood of being hit in the head in kids is actually higher than adults because it takes up more of this surface area. Also in kids, the brain is relatively heavy compared to the rest of the body, and kids have weaker neck muscles, so they are more vulnerable to traumatic brain injury compared to adults. The other population I would focus on is the elderly. So remember, I just said the brain is up against the skull. However, as we age, and in some diseases like in chronic alcoholics, the brain starts to shrink and pulls away from the skull. So there's a space between the brain and the skull. When there is that space, there are veins that connect your brain to your skull, and you can imagine that the veins are now undergoing some traction. They're being pulled. Elderly people have more fragile blood vessels. And so when you're pulling the brain away from the skull, you can imagine that it doesn't take very much force to cause these blood vessels to tear and cause bleeding in the area. And so these are the two populations that we're more concerned about when it comes to head injury. Even though children have a bigger head and it's heavier and they have more surface area, children are more resilient than adults for a variety of reasons. One, their skull is not quite as hard as ours as an adult, and so they can absorb more forces than the adult skull can. And so it dissipates the force over a greater area, so they don't have as many injuries as you would expect, given how often they put themselves in situations where they would be injured. So children are bounce better, are more resilient to head injury. That being said, it still occurs at a pretty high rate. So, when deciding what to do after a head trauma, I think it's important to understand the different severities of head trauma. And I think that will help the person figure out what to do next. So, we classify head injury in sort of three different grades, three different scales: mild, moderate, and severe. So, mild is it's when you bump your head lightly against something that's like a low hanging branch or when you fall. And symptoms would be milder, like a headache or confusion, some dizziness, even a temporary loss of consciousness under a couple of minutes. And people typically feel foggy. In this case, it's hard to know whether you should go to the hospital or not. But I always recommend if people are vomiting, that's a sign that there's increased pressure in the head. People should go to the hospital. If people are acting funny or not quite themselves, or they can't move a specific part of their body, or they're having numbness or tingling, that should be evaluated in the hospital. But a headache that's manageable can stay home. Of course, after a head injury, we always want to put ice on it. And I actually recommend that. It keeps the swelling down. And so that's all okay. If there's a laceration or a cut, or if it's bleeding very much, then that should be evaluated because lacerations to the head tend to bleed quite a bit and they're typically very hard to control. Then we get to, at the other end of the spectrum, is the severe brain trauma. This is the most serious kind of injury, and it results from a significant impact or trauma to the head. And it's like being involved in a high speed car accident or falling from a high up space. And symptoms of this can include loss of consciousness for an extended period of time, quite a bit of confusion, even seizures, weakness, numbness, profound changes to their behavior. That all should be immediately seeking medical attention because it can result in long-term disability or impairment. So if somebody's acting very differently, if this was a big car accident, if this was a big insult to the brain, that should be seen immediately. If there was an extended period of loss of consciousness, so more than like a minute, I would be seen in the hospital. And then the moderate sort of falls in between there. There's not a really good definition of moderate head injury. It's just something that's more significant than mild, but less severe than severe. And so the symptoms can fall under many different categories. So, like I said, headaches, nausea and vomiting, dizziness is pretty commonly seen, confusion, memory problems, changes in your mood. So, for example, being irritable or mood swings. Some people will have sensory changes like blurry vision or ringing in the ears or sensitivity to light. Weakness or numbness or things like seizures should be seen immediately. If someone has symptoms that don't resolve pretty quickly within a few minutes, I think it's not unreasonable to go be seen in the emergency department just to make sure that there's nothing else going on.